Good afternoon. My name is Beverly Osby Fulks, and I'm a student, and this is Pam. She is going to be honored to be my patient today, and we will be doing HEENT assessment. So, Pam, anytime you need a break, just say we need a break, and we can stop. Okay. You would feel, I'm going to mush her hair a little bit. Her scalp to make sure that she doesn't have any head up. We will also, while we're at this point, temporal pulse, and it's equal and strong bilaterally for lymph nodes. And actually, you got a lymph node right here. Lymph nodes, and actually, you got a lymph node right here. You're gonna feel the post-auricular, auricular lymph nodes. You're gonna feel the occiput lymph nodes. We're gonna feel, hold your head up for me. We're gonna feel the posterior sternocleidomastoid lymph nodes, the anterior ones. We're gonna feel, or you would get mastitis if you had, not mastitis. Oh, what is this called? Parotitis, and I don't feel anything there. And we're gonna feel the omentum. There you go. And do me a favor. I'm gonna just hold your head right here, and we're feeling your TMJ joint. And I want you to open and close your mouth. Awesome. Great. You doing good? Mm-hmm. All right. Now we're gonna move over to this Sellings chart, and we're going to do visual. What I want you to do is take your right hand and cover your right eye and tell me, can you read the top letter?
E.
Okay.
FP, TOZ, PDC, LPED, PECFD, EDF, CZF, FELOPZD, DEFFQTEC.
That's really good.
I can't see that one.
Okay. So I have to lean forward. So Pam, on the right side, you are a 20/10. Mm-hmm. Awesome. And that's corrective vision.
Yes.
So now take your left hand and cover your left eye. And we're gonna, we know you can see this.
Mm-hmm.
Okay, so we're gonna go here.
TOZ, PDC, LPED, PECFD, EDF, CZP, FELOPZD, DEFPOTEC, LETODPOT, as far as I go.
Okay. So you're a little better than 20/10 on the left. All right, you can have a seat, Pam.
Thank you.
Duck, and then we're going to do the ophthalmoscope exam. Okay. So I'm going to touch your face. And conjunctiva is pink. Sclera is white. You can see the lacrimal duct over here. We're going to repeat the same process on the other side. I'm going to switch hands here. That's the same on both sides. Okay. Now we're going to do ophthalmoscope exam. I'm going to turn on the ophthalmoscope. We're at 0. I'm going to turn the ophthalmoscope to about 80% power, just so we can better see the structures. And thank you, Pam. So with the ophthalmoscope exam, I'm gonna use my right eye to look in your right eye, and I'm gonna use my left eye to look in your left eye so that I don't hit you in the face with the ophthalmoscope. I'm trying to think. It might be better to stand. Thank you. my hand to steady your head, and I'm gonna lift your eye. You try to open your eye as wide as you can. Right and right. And I can see the red reflex. I know we're getting close. Just try to look straight ahead. And I can actually see structures in the back of the eye. Okay. Oh, that was on my knees. I'm gonna fix this back to 0. I actually could see the macula and blood vessels, arteries, and I could also see veins in the back of your eye. I could see your optic disc, but I couldn't see well enough to do the 4 quadrants. But I did see the structures in the back of the eye. That was cool. I'm sorry I made your eye tear up.
That's okay. My lacrimals work.
Your lacrimal ducts work. Okay, so now we're gonna do the same thing with this left eye. Oh, gotta switch hands. Again, I can see the red reflex. And again, I can see the structures in the back of the eye. Whoa, can you tilt your head back just a little bit? Again, I can see the macula, the optic disc, veins, and arteries. Thank you so much, ma'am. All right, now, up and back so that we can visualize now. Up and back so that we can visualize the ear canal, and again, you can see the eardrum. It's pearly white, no bulging, no redness. And it really does look like there's a pearl in your ear. Now I'm gonna look at your nose. I'm just gonna kind of take your nose and kind of push it up a little bit to see your nose structures. So her nares are patent. You can visualize the turbinates. Again, nares patent, visualizing the turbinates. Okay, say ah.
Ah.
Say ah. Ah. So I can see her uvula. Lick your tongue out. Ah. Doesn't have any drainage. I can also see her soft and hard palate. Ah.
Ah.
And lift your tongue up for me. Also, her teeth are intact. I don't see any broken teeth. Her lips are a little dry, but not chapped. Now I'm going to feel your anterior and or frontal and maxillary sinuses. So I'm going to touch your face. Are you having any pain?
No.
Any pain?
No.
Awesome. Okay. The next thing I'm going to do is I'm going to check your thyroid. And so I'm going to come around to the back. I'm going to put my fingers like right in front, in the front part of your neck. And if you could swallow for me. Big swallow. Sorry. Okay. I didn't feel any type of nodules or lesions. And then can you hold your neck up for me? And your trachea is midline. Okay. The next thing we're going to do is we're going to feel for your supraclavicle and infraclavicle lymph nodes. And if you just kind of tuck your chin a little bit, that'll open up your clavicle fossa. Awesome. I'm going to check your carotid and also check for bruit.